shortcomings, which I think goes through some kind of feelings during the treatment and after that, wherein you feel your confidence levels have been badly hurt. And this was one step for me. The initiative which Apollo came up with, I thought I should take it up, to overcome these fears of mine. The journey to the Ara Bugyal, that was 11,830 feet above, was really, really beautiful. We were 8 cancer survivors from Apollo, as well as 2 doctors and 2 nurses who were always there, helping your morale up. So anytime you felt a little down, you would look at the others, you would learn from experiences, you would feel, okay, you're a team, you have to do it. And yeah, you would feel that, exhaustion at times, you would feel tired, but looking at everyone else, it was really nice going up together, shoulder to shoulder, hand in hand. It felt so good. And when we were there on the top, it was like, yes, I think all of us realized that, life doesn't stop after cancer. Get it treated right in time and yeah, you're back to normal. You work, you continue with life normally and you can enjoy, you can do things which normal people also do. So that was what made us all feel really good. And yeah, somewhere, that the triumph over your fears, that was what I felt. And it was really, really fulfilling. It was the most beautiful thing I have done for a very, very long time. I think I did not expect these, I didn't have those expectations from myself. But when I did it, yes, I did feel very triumphant. And for all you women out there, out in the world, there's just one small thing that a small message that I want to put across. We women in our daily life, in the hustle bustle of our lives, we tend to ignore ourselves. We tend to put our health last. Everything else comes first. Don't do that. Take 10 minutes of your time once in a way, examine yourself. Maybe you will get to know that there's something wrong and immediately act on it. And yes, this really helped because when I went to my doctor the very first day after I discovered there's something wrong, I was in denial. I thought nothing can go wrong with me because I had a fairly decent lifestyle. But this was something which was not expected, but it was treated well in time and I'm really thankful to my doctors. They were really, really caring and they gave me the best treatment. So here I am today, like all the other 8 survivors who made it to the top. So thank you very much for this story, allowing me share this story with all of you. And thank you again, Apollo Cancer Centers, because if it was not for them, I don't think I would have gone in for it. This initiative was something which I just grabbed the opportunity. So thank you so much. Thanks a lot. Thank you.
So, any questions?
Yeah. And I did take a sabbatical of a year for the treatment because it was a very intense chemotherapy. So I had to take a sabbatical for a year and I'm back at work now. Just post the treatment, I'm back at work. It's 2 years now.
The reason why cancer happens can be multifactorial. It is not that there is one thing which can cause cancer. There are many things that can go wrong and then cancer happens. Yes, the changing lifestyle. First of all, aging itself can increase the risk of cancer, especially in women. If you talk about breast cancer, not having children or not breastfeeding, having a child late in life after the age of 30 years, obesity, alcohol, smoking, sedentary life. These are many, many things which can contribute to cancer. Some of the cancers there is a specific cause, but most of the cancers are multifactorial where there is no one reason that can go wrong. Yes, stress is known to cause, but it cannot be quantified. So yeah, and there's no one particular profession. I don't think she's in a profession which could have led to cancer. But to pinpoint, yes, it is difficult unless it is a hereditary cancer, wherein a person has inherited a faulty gene which has been running in their family. In those cases, yes, we can pinpoint and say that this particular gene is the causative factor. But in her case, none of that was true. Then the chances of recurrence are very, very less. The problem occurs when the woman comes to us in the beginning at a later stage. And that is what unfortunately happens in our country, where more than 60% of women come to the doctor for the first time when the disease is already in an advanced stage. And the reasons for this could be many, many. One is ignorance. One is, like she said, the woman's health is very, very low on priority for her own self, not only to the society, but even for her own self. And I've seen this also in educated women. It's not that only the less privileged one go through this. Even the ones who are educated and so-called aware can come to us a little late. So education and awareness are two different things, in my opinion. One may be educated, but being aware is extremely important. So the chances of recurrence go high, one, when at the onset the disease is already in an advanced stage. So early is a game changer. That is where our focus needs to be. Yes, certainly there are a lot of things that can be done to detect the disease early, what we call as breast screening. There are different methods that we use to detect the disease early, much before it becomes symptomatic. So one thing is we would recommend all the women 20 years and above learn breast self-examination, which is a very simple thing. It's no rocket science, which any woman can learn and practice it once in a month. And all the women who are 40 years and above, we would recommend to undergo a test called mammogram. I'm talking about breast cancer because I treat breast cancer patients. To undergo mammogram. Mammogram is a kind of X-ray we do of the breast, which can detect an abnormality when it is so small, so tiny, when it is few millimeters in size that it may not even be felt. So these are certain things which can be done to detect the disease early and to reduce the risk. There are many things about probably cervical cancer. Dr. Rani will be able to tell us how can we detect the cervical cancer early. These are the two cancers which occur in women most commonly in India, and they contribute to about 90% of women-related cancers in India, that is breast and cervical cancer, where screening is possible, where early detection is possible, and where we can look at fantastic outcomes.
As cervical cancer are the two common cancers in women. Previously, cervical cancer was first, now breast is taken over. So as you all asked about the survivor, what is the recurrence rate? See, in my department, as I said, cervical cancer is one cancer every sexually active lady is at risk of developing. Every sexually lady. So this is because it is caused by simple virus. And 2 days back, I'm sure you must have seen the article in the newspaper saying that government is kind of rolling out the cervical cancer vaccine into the immunization schedule. So this is the only vaccine which is available to prevent cancer. So that is the cervical cancer vaccination. It's been there across the world for many years, and we are fortunate that government this time has taken over and kind of will be implementing into the immunization. Immunizing against cervical cancer is the first preventive step we can take. This vaccine is advised both for boys and girls. The second step is when the lady is sexually active, we advise every 3 to 5 years to come for a screening. Because as I said, every lady is at risk. A lady can never escape this cancer. But there is prevention by taking vaccine and getting a pap smear test once in 3 to 5 years until we are 65. So by doing this, we can prevent cervical cancer. Abroad, many countries are on the verge of eradicating this. So cervical cancer can be easily prevented, and lifestyle modification, we are seeing obesity is leading to uterine cancer these days. So again, as Dr. Jayanti said, early detection, I always tell patients, You know your body. If you feel something is abnormal for quite some time, don't just ignore. Just go to the hospital, let your doctor examine you and get a proper treatment, because early treatment is the best treatment, and that is the best thing we can do for ourselves.
I went through the chemo and the radiation for about 7 months actually, and thereafter within 3 months I was fine. I mean, fine as in energy levels. I think I was okay. There was absolutely no problem there. But yeah, I've been going for my follow-up checks regularly, and so far so good.
ಹೊಸ ವಿಡಿಯೋಗಳಿಗಾಗಿ ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡಿ ಮತ್ತು ಬೆಲ್ ಬಟನ್ ಮೇಲೆ ಕ್ಲಿಕ್ ಮಾಡಿ.